You're finally getting ready to leave the recovery suites. We hope you had a great couple of days. What I'd like to do is just go over your discharge instructions so you're comfortable once you get home. Keep in mind that we've probably already made your follow-up appointment for you. If we haven't, please schedule that appointment even before you leave so you know when you come back to see us. Please resume all of your home meds. So there's medications you've been taking either for years or new medications from your doctor. Please resume those medications. Your bandage will be removed in about 7 days. You've probably already had a shower in the recovery suites, so you know it's okay to shower. Please avoid soaking the bandage in bath or tubs for a period of 3 weeks. Now, after 7 days, we're going to remove that bandage. If it's nice and dry and your wound is nice and clean, then we'll go ahead and leave it off and open to the air. If there's a little bit of drainage on there, then we want to avoid showering or getting it wet or even cover it again. If there's excessive drainage, please contact us so we can figure out why. We're going to prescribe some stockings, the Ted Ho stockings that you wore while you're in the recovery suites. Those stockings are to be worn during the day, but you can certainly have them off at night. Please call our office if you experience a few things. One of those is a temperature greater than 101. This might be indication of an infection, and we certainly want to be on top of that. Secondly, if you have any numbness or tingling in your legs, that just concerns you because you didn't have that prior to surgery. Finally, you have a dressing on. If it looks like you may be bleeding through or seeing some drainage, please don't hesitate to contact us. I'd like to review your medications with you so you're comfortable taking these medications at home. Some of them may be new. We may prescribe them for you. The first is your anticoagulation. And what that means is we want to prevent blood clots. One of the most common medications we use is good old-fashioned aspirin, 325 milligrams, enteric-coated so it doesn't hurt your stomach, and that's taken twice a day for 21 days. If we have prescribed Xarelto, this is an upgrade from aspirin because we wanted you to have a little more anticoagulation. And this is taken once a day, typically for 11 days, and we switch you over to the aspirin for the remaining 10 days. Finally, some of you may have been taking Coumadin, which is a blood thinner that's been around for many years. You've had a hard time getting that dose right, and we're going to ask you to return to the preoperative dose or contact your physician that has prescribed the Coumadin in the past. Secondly is a stool softener. Stool softener is very important. The pain medications, which we're going to discuss in a minute, cause constipation. We ask you to take 100 milligrams of Colace twice a day while you're taking the pain medication. But keep in mind, this is not a laxative. A laxative is something like milk of magnesia, or Ducalax, or magnesium citrate, which is the big hitter. If you haven't gone to the bathroom and you haven't had a bowel movement in the first 3 to 4 days, either contact us for recommendation or consider a laxative with the pharmacist. And you may start with just some simple milk of magnesia. But please remember to continue the stool softener while you're taking the pain medication. Phenergan is another medication we provided for you, and that's a nausea medication. You may take that once every 6 hours while you're taking your pain medication or other medications if you feel nauseous. But keep in mind, Phenergan's going to make you sleep a little. It causes drowsiness, and taking that with the pain medication might really knock you out a little bit. So please be careful with the Phenergan, certainly if you're driving or you're up doing things that require you to be alert. Next is gabapentin, and this is a medication that we use. It's a nerve-mediated pain medicine. So you might experience with your new knee or your new hip some burning around your incision or some burning in the area that we fixed. Or at night you might notice that when you stop your day. Gabapentin is terrific for night pain as well. It also causes drowsiness, can cause some dizziness, can cause you to lose your balance a little bit if you take it. So please be careful. We've already probably given it to you here in the recovery suites, so we know how you experience gabapentin. I'll tell you one nice thing about gabapentin as well. It's very safe, as you take it in the dose we provide, and it does allow you to sleep a little bit better, it's not a medication you're going to develop an addiction to. So it's very safe to stop the dose of gabapentin that we provided to you when it's time, certainly as your pain improves over the first few weeks after your replacement surgery. Now let's have the big conversation, which is narcotics. All of you are very aware of the opioids. It scares everybody, frankly. And on our end, it's the curse and the blessing. Obviously, it's the blessing because it provides pain relief. Well, it can certainly be the curse because it provides constipation, dizziness, lightheadedness, hallucinations even. You won't believe some of the stories we've heard. We certainly don't want you to have those. Hopefully, we've given you pain medication while you've been in the recovery suites. So therefore, you may know how you're going to react to that medication. It could be oxycodone, could be hydrocodone, as those are two common medications that we use. The dose is 1 to 2 tablets every 6 hours. And again, hopefully you've had some experience with this dosing prior to your discharge. Now, what's the big fear? The big fear is addiction. Well, physical dependence and addiction are very different. Physical dependence means your body got used to the medication, which can happen over the first 1 to 2 weeks, which is the time we need the narcotics the most. To wean yourself off of that medication, and please don't stop it suddenly, you will feel terrible. But to wean yourself off of that medication, the first thing we want to do is cut the dose in half. If you're taking 2 tablets every 6 hours, let's go down to 1 tablet every 6 hours. Once we've done that for a day or 2, now let's start spreading out the time that you take them. So if you're taking them once every 6 hours, let's go to once every 8 hours. Let's do that for 2 days. Then let's go to once every 12 hours. Let's do that for 2 days. Now, if you tolerate that 1 tablet every 12 hours, which is 2 tablets a day, now you're safe to stop the medication and not feel so terrible or feel like you go through symptoms of withdrawal, which may also include dizziness, upset stomach. You might feel a little jittery. Those are signs of weaning off of your medication. Finally, we may also provide you with some iron pills. If we've noted that your blood count dropped a little bit, because we check it while you're in the recovery suites, we'll provide you some iron pills, and we encourage you to take them until you finish them. I hope this has helped with the medications. Please go back and listen to this over and over again, especially the area about the narcotics. We certainly don't want you to be miserable, but we want your pain to be relieved so you have a great outcome to your hip or knee replacement. Home health care will be provided at the time of discharge. Before you leave, we'll connect you with your home health provider, as we've contacted them maybe even right after you got here. So please make sure when you leave, you know who it is, you know how to contact them. We're actually going to follow up with you afterwards, maybe a day or 2, to make sure you've received some contact from the home health company. Keep in mind, it might take 48 hours or so for them to get there. With all the different insurance companies are out there, some of them use certain home health companies and some of them use ours. We also have our own home health company to fill in the gaps and certainly make sure you have a great home health experience. A walker will be provided for you when you leave. You've probably gotten used to the walker with your stay with us. And most people, frankly, don't have a walker at home. So we're happy to provide that walker to you. And we ask that when you return to your visit in 2 to 3 weeks, would you please bring that back, because we'll clean it up and we'll have somebody else take it home so they can benefit from it as well. You'll receive a phone call from a healthcare provider company, and they're going to bring you some goods. They're going to bring you some of the things you used while you were here with us. For instance, the ice compression. How about the compressors that squeezed your calves to help us prevent blood clots? We're going to bring those things to your home. So don't hang up on them or think it's a prank call, because they're trying to bring you something to help you. Any questions, certainly call us if you're just not sure. If you've had a knee replacement, we're going to send that motion machine home, whether you want it or not. And we recommend 0 to 120 degrees, 2 hours twice a day. Now, if you can't get that 120 degrees right away, let's set that as a goal in those first 3 weeks. 0 to 120 degrees twice a day is going to be our goal while you're at home. A CPM is not required if you have a hip replacement, so don't wait for that call. Home health care itself can sometimes be a little behind in getting to your home. We'll follow up with you shortly after your discharge, but certainly if you have not heard or seen a therapist or nurse in the first 48 to 72 hours, please contact us. I don't care if it's the weekend. Make sure you have the proper home care in those first 48 to 72 hours. I'd encourage all of you when you get home to visit CrovettiOrtho.com. Over all these years, we've been working on videos to answer all your frequently asked questions. Well, this instance is no different. You get home, you have a question, I don't care if it's 11 at night, midnight, go to CrovettiOrtho.com, go under our videos, and look at some of the answers to your questions. It'll be me, again, answering a question that you've had probably all afternoon and just didn't want to call. So check out those videos. If you've had a knee replacement, you can see on our website there's a spot where you can learn about the first 30 days. I spent some time on each day to inspire you, to tell you what to expect. When you have no idea what's happening to you, maybe some of those videos will answer some of your questions. And you might think to yourself, geez, that actually happened to me today. We've done a lot of knee replacements over the years. I think those first 30 days are super important. So please visit the video section of our website, CrovettiOrtho.com, to see your first 30 days of knee replacement.